All right, everyone, it is Dr. Nurse Tutor. I am back with a part 2 of the first video that I made reflecting as to why adult health Medsurg students are failing these exams and understanding what the kind of questions are we're looking from you and how we want you to answer these questions. You're going to commonly see prioritize. You're going to see select all that applies. You're going to see education questions. You're going to see case studies and drag drops and bow ties, all the things, right? When you're looking at a priority question, priority always means what are you going to do first? What is the most important thing that you're going to do? With priority questions, they're always going to be related to airway, breathing, and circulation. The answer should always have something to do with airway, breathing, and circulation. But Dr. George, I still get it wrong. I know. Let me tell you why. You get it wrong because you always skip the most important thing. I always tell my students, if the question doesn't say the supplies are in the room, the supplies are not in the room. Please do not assume that suctioning supplies are in the room. Please do not assume that oxygen is in the room. Why? Because all these things need an order. When you're walking into the room and something's wrong with your patient, always envision it as it's just me, my patient, my stethoscope, and the Dynamap. There's nothing else in there unless the question says it's in there. Now, what would be your priority if that was just it? Stop assuming there are things in the room if the question doesn't say it. It's not there. So if it's just you, your patient, your Dynamap, and your stethoscope, the first thing you should be doing is look and see if there's an answer that says sit them up. Sit them up, cough, and deep breathe. That's the first thing that you should be doing with anyone who's having difficulty breathing. If it is an intervention, right? That question, here's how you have to look at the question. I always say, look for an assessment in the question. If there is an assessment in the question, meaning your patient is having difficulty breathing, you walk in, you auscultate, you check vital signs, you check level of consciousness, the patient is being assessed in the question. If the patient is being assessed in the question, do not choose an assessment answer. The question is already showing that the patient has been assessed. If the question doesn't say there is an assessment going on, there is an assessment in the answer. Make sure the assessment matches with the problem. Assessment in the question, you have to do something. If something is wrong and there is no assessment in the question, you have to look for an assessment answer related to airway, breathing, and circulation. That patient can't breathe, the first thing you do, you sit them up, high fowlers. Ask that patient if they can cough and deep breathe as hard as they possibly can to clear those secretions. That is your priority as the nurse. You can't put oxygen and you can't suction anybody until you've had that patient try to do something by themselves. If the question has an assessment in it, the answer will not be an assessment. If the assessment is in the question, the answer will not be an assessment. Okay? If there isn't an assessment in the question, the answer is an assessment. You can't do anything until you assess the patient. Nobody can assess but the nurse. Select all that applies. Like I said before, for all manifestations, when you're writing your notes, put an intervention next to every single manifestation. Once you put an intervention next to every single manifestation, prioritize it. What is the most important? And go down the list that way. Because when you get a select all that apply, that's how I want you to answer the question on the exam. I want you to tell yourself, this is the problem. They got a whole bunch of answers. There's more than one is going to be true. Stop asking, is select all that apply? Is it 2 or is it 3? Don't look at it that way. If the patient can't breathe, tell yourself all the things that you're going to do for someone who can't breathe. Once you get it down in your head, then go look at the answer choices. Because if you already have it down in your head, all of the interventions that you're going to do for this problem, when you get to the select all that apply, it cannot trick you. Because I've already decided in my mind, based off the book, based off my notes, based off the PowerPoints, these are all the things that I have to do for someone who can't breathe. When you get to the select all apply, you're just going to check, boom. Now, I'm not doing that. So you're going to X that off. Put a line on it. The exams have the option where you put a line through it. So I already know. I'm not even going to second guess that. I already know in my head because I already told myself what are the things that I can do as the nurse for this patient. With select all that apply, don't let it trick you. It's going to give you every single intervention, the ones that you need orders for and the ones that you don't need orders for. That's when you can get crazy with it. You don't have to worry about if there's an order, because it's going to tell you as prescribed. So every single intervention that you can do, write it down. then go looking for it in the answer choices. Because if you sit there with 5 different answers, you're going to be second guessing yourself all day. Stop getting partial credit on select all that apply. Do your manifestations, put your interventions right next to it. Not memorize. Please don't memorize. When you get to that exam and you see the problem, automatically tell yourself, all right, this is how they're going to look. This is what these are all the things that I need to do. Based off of all the things that I know that I need to do, now I can go look at these answer choices and see what it is I need to answer. The case study questions. A case study question is literally report. They're giving you report. This patient is 58 years old. They're coming in with COPD exacerbation. The patient's PaCO2 was 56. The patient is mildly acidotic. The patient is satting 75% on 2 liters. The patient's vital signs look like da-da-da-da-da-da-da. The labs look like this. Based off of the assessment, this is what we found, which means the assessment is in the question. So now they want to know all the interventions that you're going to do. You need to write down all of the problems. COPD patient. Patient got a PaCO2 of this number, which means they're mildly acidotic. We got to get CO2 off of this patient, right? The patient's pulse ox is down below in the 80s, right? The patient has decreased level of consciousness. This patient got wheezing or stridor or whatever have you. Right? Now you got to ask yourself, what are some things that I can do to help this patient? I know I need to sit them up. That's an intervention. I know that I need to have this patient do pursed-lip breathing. I can do that without an order as a nurse. Absolutely. Right? If it says as prescribed, can this patient get oxygen? No, because y'all just said they're already on 2 liters of oxygen. We can't max out on that. They've already maxed out on the 2 liters. If I give a COPD patient more oxygen, that can cause oxygen toxicity and further increase the CO2 in the lungs, which could worsen the acidosis. So what kind of oxygen does this patient need? This patient needs a Venturi mask. The Venturi mask is going to give the patient the exact amount of oxygen that they need while removing the CO2. Think about all of the things you need. They already gave you a report. They already told you the patient's been assessed. Based off the assessment, this is what's wrong with the patient. What are you going to do to help that patient feel better? This is how I want you guys answering those questions. Start off with the pathophysiology. Give yourself the manifestations. What are the interventions for every single manifestation? What are the medications the patient is going to need? What are some complications that can arise? Right? Nursing interventions are always things that nurses can do. The only way that you can give oxygen or give medications is if the answer choice says as prescribed. You're not giving anybody a bronchodilator until you've done all the things. You've auscultated the lung sounds. You've checked. You've done a focused respiratory assessment on this patient. Meaning, you listen to the lung sounds, you check the respiratory rate, you check the pulse ox. If you need to give this patient oxygen, it's going to say as prescribed. If you need to suction this patient for any reason, it's going to say, the question is going to tell you to suction the patient. Suctioning will never be your first answer. You can't suction anybody first because you're going to compromise the airway. Prioritize your answers. Prioritize your interventions. Once you prioritize from most important to least important, if the question says prioritize, go to the most important thing. Most important will always be the thing that you can do that you don't need an order for. Do not assume that supplies are already in the room. If the question doesn't say there's things in the room, those things are not in the room. If you work in the hospital, they love you guys because y'all always get stuff wrong because y'all want to do stuff the way the hospital does it. Every hospital has a policy and procedure. The NCLEX in your exams do not have policies and procedures. It will always just be you and that patient in the room with no supplies. Understand that registered nurses are experts in their craft. Whatever you see them doing in the hospital is not going to be the answer on your exam because they're experts. They know how to do everything at once. You don't know how to do anything. You're a novice, meaning you're a beginner, meaning you have to slow yourself down and do everything one at a time. This is the stage that you are in. Okay, I'm actually going to make another video as to why the things that people do in the hospital are different from what we're telling you to do in school and on your exams. Okay, I hope this helped. This is Dr. Nurse Tutor, and of course, I'm going to make a part 3 because there's more that I need to say. All right, I'll see you guys soon.